Imagine seeing a pandemic, seeing a region being totally overwhelmed, knowing that at that time they'd be going through hell, knowing that doctors were having to choose who to save and who to let go. And imagine volunteering there, not to go help people out with your skills and training, but to try and make a buck. Well, that's what this sick nurse, who's making waves and has now appeared on Fox News' premiere show, Tucker Carlson's one, has done. It all started from this viral interview called The Undercover Epidemic Nurse, which I'm going to be breaking down now bit by bit because someone needs to. Basically, this lady joined a group of volunteers and relief workers and went to New York when the pandemic was really raging. She worked at Elmhurst Hospital while the pandemic was at its peak. The hospital was overwhelmed, and she ended up secretly recording her co-workers. She filmed and apparently stole confidential patient data, and instead of trying to bring it up with hospitals or colleagues outside of this, which she has, she started posting about it on Facebook and has magically written a book she's trying to sell because of course she did. Now, she calls herself the forensic nurse on YouTube. Of course she's got a YouTube channel. But she lied and deliberately admitted so much in this investigation. And her lack of training shows here a lot too. You guys need to check out ZDog MD's breakdown of this and read the words of other doctors at the scene, some of which I will during this video, because they're poignant. Unlike her, because they're actual professionals who respect patient confidentiality and the law, they didn't put this out to the public, but ZDog is releasing it for them completely anonymously. Early on in that interview, she claims that because people who were negative for COVID-19 were being ventilated, that was horrible. First off, tests were returning false negatives at 40% rates in this time. As this physician explains, while it is true that some patients tested negative, those patients all had horrendously deranged inflammatory markers and chest x-rays clearly demonstrating lung injury. In this case, the responsible thing to do is to assume COVID positive and give the available treatment. You're in the middle of a pandemic. A lot of patients are coming in with the same signs, symptoms, and scan results. You don't have enough beds, yet alone enough tests or time to test people. What else could it be but COVID-19? And even if it wasn't, how would treatment change if someone comes in who's short of breath and needs help? One of her nurse colleagues points out that all this time the hospital and ICUs were 80% over capacity. Remember this. This is not normal ICU. This is not ED, the place where Erin is apparently trained as well. She made a fuss about people not receiving hydrochloroquine at the time. Well, A, first off, some were, and B, the records of one nurse indicate that in one patient, he was also receiving hydroxychloroquine and azithromycin. Guess what happened next? He had an MI, myocardial infarction. That's what landed him on the ventilator in the first place. She made a fuss about dentists being there around 15 minutes into the video. In the words of actual staff on the ground, the dentists and ophthalmologists working in ICUs have a defined role. They are the medical professionals that FaceTime family members at bedside. They are not treating. As ZDog points out in his video, the residents she was criticizing the whole time have much more training than her in ICUs. As I point out later, she doesn't even know common protocols and medicines that are followed and prescribed routinely in them. She's questioning the training of the staff this whole time, but she doesn't mention she's not a critical care nurse or ICU trained herself. That's a huge difference between her being an ED nurse apparently and an ICU one. In the words of another colleague who also volunteered to help her out in New York, Erin Marie is not a critical care nurse she claims. She is an ED nurse. She was taught there how to inline suction, how to titrate drips, and how to open and insert the chamber into the episyringe during a code. She claims her knowledge from what happened to her in Iraq makes her qualified to talk about this. She was 17. She wasn't a nurse at the time. I don't even know where she was deployed. She has no training at that point. She didn't even know how hospitals worked. Around 30 minutes in, she lists a bunch of standard medications given to patients who are really sick in ICU. Propofol, fentanyl, Presidex, heparin, Levophed, vasopressin, propofol, Nimbex, paralytics. Remember, she's not an ICU nurse. She only came in like a vulture to help during this time. The list she gives is standard in intubated, severely ill patients whose blood volume you've got to monitor. You've got to be sedated while you're getting ventilated. I've been on these all myself when I had tamponade after open heart surgery, as well as other times during my cancer journey. I know, a decent chunk about them as a medical student. Nowhere near as much as an ICU specialist will, but it's necessary and common. And her not knowing this is indicative of how woefully ignorant she is on this topic. Remember, she's an anti-vaxxer, pro-natural everything as well. She believes vitamins that supposedly helped her not get COVID-19 can be used to deliver similar results in patients who are literally circling the drain and unable to breathe on their own. Like, that's not how it works, bro. Speaking of circling the drain, at around 32 minutes in, she goes on to talk about happy hypoxics, people with low blood oxygen saturation who appear normal. And she spent a lot of the video talking about ventilating them and how you shouldn't be doing that. Now, this is something we still don't understand today. In New York at the time, they had no clue on what to do and were treating what they knew, acute respiratory distress syndrome, which a lot of patients with COVID-19 were turning up with. Hospitals and systems were making policies about who to treat and who to save, knowing that you couldn't save everyone and that focusing non-existent resources on people who didn't have a good chance of getting through would lead to more people dying overall. This seems barbaric, but in the end, that's what COVID-19 was doing. That's what it still could do if it gets out of hand, if we follow the advice of people like her and go outside and not distance and not wear masks and basically increase our risk of COVID-19. This wasn't a normal hospital. This was all happening during a crisis, one she came into knowingly, because Italy had seen all this happen, to profit off. She's a nurse, not even trained in this field, trying to assert something that hundreds of nurses, doctors, and other professionals are still trying to figure out. In fact, while she was at New York, none of this stuff was actually published. She couldn't have thought these things. We know that she's incompetent too, because she says that healthy people go as low as 80% oxygen saturation normally. No! Like any first-year nursing or med student can tell you, the oxygen dissociation curve is somewhat exponential in nature. At 97% oxygen saturation, your partial pressure of oxygen is 95%. When you drop down just to 92%, that goes down to 60. At 75%, partial pressure of oxygen is 40. We're still not sure of how to treat COVID-19 patients.
Remember, she didn't ask at any point. Instead, she posted it straight on Facebook. And this is also despite all her hypocrisy about PPE and everything else she complained about too.
At 34 minutes, she compares her experiences in a Florida hospital to what was happening in ICUs in New York, which were overflown. Remember, she worked in a completely different environment, in emergency, not ICU, and in Florida, when hospitals weren't overflowing. Florida is now seeing thousands of cases per day. Her assertions that hospitals aren't flowing unfortunately may change. But yeah, she touts about how hydroxychloroquine was being given in the Florida hospitals to great effect and it wasn't being given there when first off, that drug, it probably works best when given early, in a place like ED as opposed to ICU, as it works to stop replication of the virus, and it's purported that its effects will be greatest there because it can then stop a cytokine storm from occurring. In stopping the virus getting out of hand early on is likely the only place hydroxychloroquine can make an impact, because in severe disease, it's already too late. Plus B, in Florida and in New York, that wasn't the only medicine they were giving. They were using different protocols, and something which was used in ARDS patients in previous SARS outbreaks to decent success rates, corticosteroids were also being used. Hydroxychloroquine, despite those retracted falsified trials, which were sad to see, has still not been shown to work in severely ill COVID-19 patients, and as of today, not in early patients either, though I think that over here it could possibly make an impact. The video, at 46 minutes, purports that hydroxychloroquine has been shown to work in previous SARS outbreaks and goes on to make wild conspiracy claims about it. I talked about this weeks ago. That study on quinine working on previous SARS outbreaks was on primate cells, not even primate animal studies, but non-human cells, and it asserts a mechanism for it working without properly demonstrating it through their study as well. Marie also talks about a doctor who prescribed an antibiotic alongside hydroxychloroquine, and she couldn't name that antibiotic. In fact, she was confused by it. First off, it's azithromycin, and it's not being used just because it's an antibiotic before people go away starting to hoard and use penicillin. Azithromycin has anti-inflammatory effects in the lungs in particular. I've been on it myself But this is a drug that anyone who's been reading up on COVID-19 treatments should know off by heart. She doesn't know anything about it at all. She is not an expert. This was 44 minutes into the video, by the way. 49 minutes in, she talks about x-rays and how they're all mucousy and white. Again, she can't describe these with medical terminology and smiles as she's being questioned about it because I don't think she knows what she's talking about. She then goes on to talk about vitamin D and C therapies, giving lungs the power to kick out mucus, and saying we should be giving people IV antibiotics. She says, I've been taking it, so it must work, as if the possible benefits of supplementation in making your innate immune system stronger means these things work in patients who are literally circling the drain, who've already had severe damage caused by COVID-19. Then she says that Florida's avoided it because everyone's been going out in the sun. First off, not only is there no evidence of that, right now, Florida's seeing exponential rises right now. Be safe if you are from there. Going out in the sun is not going to save you. It might help, and you definitely should do it, but it won't save you. She finally says that the crazy amounts of lines and traumatic procedures going on was what was killing them in hospital. It's ICU, lady. You can't keep sticking people who could be coding at any time, who could be in there for weeks with 72-hour cannulas. You need lines in there, as her colleagues point out. She talks about a patient who was strapped down as well, just because he was a psych patient. Dude, I was strapped down in ICU. A lot of people in ICUs hallucinate. ICUs suck. You don't want to go there. 12% of ICU patients are between 20 and 44. Up to 1 in 50 children who test positive for COVID-19 end up in PICU. This is all reasons why you should avoid going into hospital, guys. There are so many grifters out in this time. It's really depressing to see, to be honest. Apparently becoming a YouTuber and selling books and propagating myths is worth more money than becoming a competent, good healthcare professional. I sincerely hope she gets sued for everything she owns or earns through this book she's selling, and that Fox News and whoever gives her play gets sued as well, because there is a huge cause of action. The actual staff at the facility, at the hospital, they're getting death threats. Imagine in a time when you're being forced to pick who gets a ventilator or not, and who gets a chance of surviving. Imagine having one of your own out there secretly recording you and painting you out to be a monster. It's sickening. And if you're someone who's inclined to believe this lady because of her demeanor and what she says outright, because she seems convincing, note that at no point in this video does she show any corroborating, tangible proof, any numbers or data about what she's saying. The same thing happened in that Plandemic video. A lady came through, made 100 different allegations, provided no evidence of any of this, and everyone just ate it up. This video, the proof she has is just her and some other nurses questioning the norms. Many of those other nurses, they were scared and depressed themselves. They're having to face the trauma of COVID-19, of a COVID-19 hospital that's been overflown. She's in a hospital that was 80% over capacity at the beginning of COVID-19 season. That's what COVID-19 can cause if you let it go out of hand. This lady is telling people to go out onto beaches, not wear masks, all the things that can make this worse and that can cause ICUs to be full and overfull again. Why would she come to a hospital she was supposed to be helping out wearing spy-like recording glasses? Like, why would you do that in the first place? I guess she knew from Italy and other areas that there was going to be some crazy shit going on and that she would be getting some shocking footage. And she's written a book about it. 100%. If you see some crazy stuff go down, some bad things, you should talk about it. You can push it through the ranks. Talk about it to other professionals outside the hospital if you think it's being covered up. You don't unlawfully, secretly record facilities, co-workers, patient health data, and confidential conversations and release them to the general public without providing any context, unless, of course, you want to sell a book. This is absolutely disgusting. I'm sorry that it's happened. But yeah, guys, if you see random nurses or doctors standing up against the grain, ask yourself this. What have they got to gain from all this? It's surprisingly quite a bit.